Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Unfortunately, due to a scheduling issue, we do not have sign language interpreters with us today. They are an important part of communicating with Albertans, and they will be back tomorrow. A full transcript of my remarks will be posted online, as always. Today, I would like to begin by talking about the COVID-19 vaccine, specifically about safety. Yesterday afternoon, the first doses of the Pfizer vaccine were administered in Alberta. It's incredible to think that within a year of the virus being discovered, we already have a vaccine that is 95% effective, and that it is already going into the arms of those caring for our long-term care residents and the sickest patients in our hospitals. We will continue to immunize healthcare workers in Calgary and Edmonton this week. When another 25,000 doses arrive next week, immunizations will expand to priority healthcare workers province-wide. I know that any time there is a new vaccine, it can cause anxiety and questions. It's important to remember that Canada has one of the most robust regulatory systems for new vaccines in the world. Health Canada moved quickly through the approvals processes, but no steps were skipped. The same rigorous testing and scrutiny was applied to this vaccine as to any new treatment. The ingredients inside it are only those needed to keep the vaccine stable and safe. And a clinical trial with tens of thousands of participants from multiple countries found no safety concerns. Health Canada is being cautious and making sure there is clear evidence of effectiveness and safety before offering vaccines to Canadians. For example, that is why it has not yet authorized the Pfizer vaccine for those under 16, as there are no trials complete in this age group yet. Because this is a new vaccine, we will also be watching closely to ensure that if any safety signals emerge, we will be able to detect them immediately. Alberta will be working with all the other provinces and territories and the Public Health Agency of Canada to closely monitor for adverse events. I believe the benefits of vaccines far outweigh the risks, and this vaccine will save lives. There is overwhelming scientific evidence that vaccination is the best defense against serious infections. We are taking every precaution and acting on clear evidence showing this vaccine is safe for Albertans and it works. When it is your turn, please get immunized. It is an act of kindness for yourself, for your loved ones, and for your community. Turning to today's case numbers. Over the last 24 hours, we have identified 1,270 new cases of COVID-19 and completed more than 17,500 tests. This means our positivity rate currently stands at about 7.3%. There are 749 people in hospital, including 139 in the ICU. AHS continues to take steps to increase capacity and expand the number of acute care and ICU beds that are available. Some of these are new beds, and in some cases, existing hospital spaces will be made available as patients are moved into continuing care beds in the community. AHS is also working with the Canadian Red Cross to set up an alternate care centre at the Butterdome on the University of Alberta's campus. As you may recall, AHS used the Butterdome as an assessment centre earlier this spring, and a temporary structure has also been in place for months at the Peter Lougheed Centre. It will take a few weeks to set up the care centre, which could add an additional 100 inpatient beds. There is no plan to staff these beds unless they are needed. This is a purely precautionary measure for use if needed in the future. Sadly, I must announce that 16 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with those who are grieving the loss of these individuals. Every death is a reminder that we must reduce the spread as quickly as possible. It is a sobering statistic that in less than 10 months, More Albertans have now died from COVID-19 than have died from influenza in the last 10 years combined. Looking to schools, there are currently active alerts or outbreaks in 452 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,964 cases. Speaking of young Albertans, as you know, last week we announced a new advertising campaign that is targeted primarily at those under the age of 40. In no way are young people the sole cause of the rise in cases that we are seeing. However, this virus affects all of us, no matter our age. Today, I want to remind anyone who is in the 20 to 40 age range that this virus also impacts you. In Alberta to date, more than 32,000 people between the ages of 20 and 39 have contracted COVID-19. More than 380 of them have been hospitalized, and sadly, 8 of these have died. To put this in perspective, if you gathered every Albertan between the ages of 20 and 39 who has been diagnosed with COVID-19, they would fill the Saddle Dome in Calgary, the Centrium in Red Deer, and the NMAX Centre in Lethbridge. This virus does not discriminate, and it can have long-term and potentially devastating impacts on all of our health. No one of any age can take COVID-19 lightly. I know it is hard, but for everyone of any age, including those between the ages of 20 and 39, it is vital to avoid in-person interactions whenever possible. This includes not having holiday parties or other gatherings in our homes. Instead, we must all look for ways to connect virtually, like the Bridges Church Women's Group in Calgary. Last week, 60 members of this group participated in a Zoom holiday celebration. This online party included an inspirational speaker and virtual tours of 6 people's homes so that others could see their impressive holiday decor. There were even door prizes that volunteers delivered to the winners' doorsteps. Events like this make me hopeful. They are proof that it is still possible to connect and have fun while following the rules and staying safe. We are all protecting each other, and the sacrifices we make in the coming weeks will help determine what the new year brings. Thank you, and I'm happy to answer any questions you may have.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you very much. The first question is from Kevin Nimick, CTV Calgary. Please go ahead.
Hi, Dr. Hinshaw. Can you be more specific about the priority list for vaccinations? Where do groups like teachers, first responders, and grocery store clerks fit in? Between them, who goes first?
It's an excellent question, and we know that there are many people in this province who could benefit from the vaccine and who serve their communities every single day in a frontline way. The first phase of the vaccine, as you know, over the first quarter of 2021, is targeted at those who are the highest risk of severe outcomes and those who care for them. As again, I've mentioned long-term care residents, the staff who work in long-term care and designated supportive living, healthcare workers who serve those highest risk in hospitals, and people over the age of 75. What we're seeing as our phase 2 would include priority groups who are more of those first responders and frontline professionals, and that is set to roll out at this time. We anticipate in April of 2021. We don't know yet exactly how much vaccine we'll have. We're continuing to work with the federal government to make sure that we are getting updates, and as more vaccine is available and as potentially new vaccines are licensed, we may be able to shift those dates if things move more quickly than anticipated, but at this point, that is our anticipated timeline. Decisions have not yet been made about which of those first responder groups or frontline worker groups would be prioritized first, and those are discussions and decisions that will be happening early in the new year. We know that all of these workers provide valuable services, and we want to make sure that we are offering immunization to Albertans as quickly and efficiently as possible, but we do need to, again, make these decisions. And the first quarter will really be dedicated to those at highest risk of severe outcomes and those who care for them.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. How concerned should Albertans be about this new variant of the coronavirus that's been identified in England, and what, if anything, do the mutations mean for transmission?
We've had a few reports of different genetic alterations or mutations in COVID-19, and so far there's not been any evidence that these mutations are as dramatically different one from another as, for example, the influenza virus, which we know mutates very quickly and mutates dramatically so that one strain is very different from another. We are, of course, watching closely developments such as the one you reference, but it is too early to know exactly what implications it may have, or if, as we've seen in some of the other slight genetic alterations, it is not a significant issue with respect to how it interacts with the population, but does potentially provide us one additional tool for helping track and understand the dynamics of the virus. And so again, we're watching closely, and it is too early to understand the full implications.
Operator, could you put through the next caller, please?
Audrey Niveau, Radio Canada.
Hi, Dr. Hinshaw. I wanted to know why we are seeing an increase in the number of schools that have cases as they are now closed. What's the logic behind this?
As I mentioned yesterday, the numbers of schools with cases that I'm reporting every day, for completeness and transparency, do include schools that are now closed. This is a function of the fact that, unfortunately, as you know, the contact tracing within Alberta Health Services does take several days to identify the individual cases and have those follow-up phone calls. So some of the cases that have been called this week were still in school while infectious. And again, we want to be sure that we're being completely transparent. So those numbers are part of our daily report, even though, of course, there has been no in-person interaction in those locations for a couple of weeks now.
Operator, could you put through the next question, please?
Lauren Boothby, Edmonton Journal.
Hi, Dr. Hinshaw. I'm wondering if you can break down who is getting a vaccine more detail, like if you have it by week for the first round. You know, this week we're going to have respiratory therapists. Next week we're going to have people in ICU, that kind of thing. Also, have you had any applications from any industry groups about who are asking if they can go earlier, and what's the status on those?
Sure. So our phase 1 of vaccine, which thankfully we're able to begin early as this week. We'd originally anticipated having vaccine in January, and of course that was advanced. And so it's the same groups that are being offered vaccine as were part of that phase 1 announcement that happened a week or two ago. So this week and next week, actually, the groups that are being offered vaccination are respiratory therapists, staff and physicians who work in intensive care units, and staff who work in long-term care or designated supportive living facilities. We are hoping, once we get approval, to be able to move the vaccine from the sites that it's delivered to, and at some point in the future, we anticipate we will be able to repackage into smaller cold chain packages and move that to an additional site. At that point, we will be able to begin immunizing residents of long-term care and designated supportive living facilities. And so it's these groups that are our first priority, again, with respect to the next several weeks, starting in Edmonton and Calgary this week and expanding across the province next week. So the next groups that are in phase 1, as we move into January, and potentially, depending on the uptake, of course, vaccination is voluntary. So the vaccine is being offered to all of these groups, but when we are able to offer it to all of those groups I've just mentioned, then some additional healthcare workers such as home care staff and emergency department staff and physicians may be able to be offered that vaccine. In addition to, once those groups have all had that chance to be offered vaccine, and including, again, the residents of long-term care and designated supportive living, then our phase 1B, which the Premier announced, again, a week or two ago, would be offered to all those who are 75 years of age and older, no matter where they live in the community. And those who are 65 years of age and older who live on First Nations reserves or in Métis settlements, and additional healthcare workers such as those who work in COVID wards or internal medicine units. And again, this is really focused on those who are at highest risk of severe outcomes from the disease and those who are caring for those individuals and who are at highest risk of exposure given their occupations, and also in the shortest supply across the system. So you'd also asked about other groups who've been asking. We have had, of course, there are many, many frontline groups, first responders, and different occupational groups who provide extremely valuable services and who we know would benefit from being eligible for vaccination. So we have, of course, been hearing from those different groups articulating the importance and we have to take all of those different considerations into account when the specific prioritization starts to happen to make decisions for phase 2, which is when all of those occupational groups would be considered, and again, anticipate decisions being made in early 2021.
All right, we'll take our final 2 questions now. Operator, could you put through the next caller, please?
Tomasi da Silva, Global TV.
Dr. Hinshaw, still sticking with the vaccine and the rollout, can you explain, we have had a few people contact us and say they're not even working with COVID patients and they're not even really on the front lines, but they're being offered appointments when they feel others should be in front. So again, can you explain how these decisions are being made? And as well, we only have a limited number of vaccines for the first round and quite a large group of those that are going to receive it. Is there a fear that we could run out?
The first 2 doses that we have, again, 3,900 this week, another 25,000 next week. We will be working, of course, to offer those to the individuals who are eligible as quickly as possible. We will need to make sure that we have enough vaccine to offer the second dose to those individuals. So some of that shipment that we're receiving next week, depending on when we're able to confirm our January shipments, we may need to hold some of the 25,000 doses in reserve to ensure that second dose availability. And again, this is ongoing work that we're doing with the federal government and with the vaccine manufacturers so that we can do this just-in-time planning. And so again, that question of running out, we know that there is worldwide demand for these vaccines. We know that Canada has advance agreements with many different vaccine manufacturers. And so we are watching and waiting to see what the outcomes are of applications for licensure and approval of the different vaccines. And we anticipate that because Canada has advanced purchase agreements with so many different manufacturers, that we will eventually be able to offer all Albertans this vaccine. The question is, of course, timing, and that is one that we will need to wait and see how that rolls out. You'd also mentioned that there are some who've contacted you saying that they don't believe that they fall into those eligible categories. And certainly if that's the case, then those individuals are certainly able to indicate that they would give their spot up in line to someone else. The process that Alberta Health Services is using at this point is a manual process where they do get staff lists from intensive care units and then manually make phone calls to all the individuals on those lists. So I can't speak to why perhaps someone was on that list when perhaps they no longer work at that location. But of course, with this kind of manual process, if those lists happen to perhaps have someone from a previous work schedule, then it's possible that they could be offered that vaccine. But again, those individuals certainly can give up their spot in line to someone else, and every effort is currently being made to ensure that AHS has accurate information while they do these manual phone calls. But there may be the odd occasion where, again, there's something that is not quite the most current.
Operator, could you put through the final question, please?
Thank you. Final question is from Duncan Kinney, Progress Report.
Hello, Dr. Hinshaw. Thank you for taking my question. I just want to confirm the fact that allied health professionals, folks like physiotherapists and social workers, are being redeployed as nursing attendants at the University of Alberta Hospital, and whether similar events, similar redeployments of allied health professionals as nursing attendants have happened in other hospitals.
The specifics of how Alberta Health Services is redeploying staff to meet their demands would be something we'll have to follow up with AHS and get back to you on. So I'm not able to provide that level of detail, but of course we know that Alberta Health Services has been working for many months to make sure that they have contingency plans to meet the demands, and when there are additional demands of caring for inpatients or ICUs, of course they have that option of trying to utilize their workforce in the most effective way possible, but we will talk to Alberta Health Services on that specific question and get back to you.
All right, thank you for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening, everyone.